An important part of the self-improvement process is recognizing when we have behaviors that have become problem behaviors that we need to change. These are behaviors that are interfering with our quality of life, and those are behaviors that we want to replace. So we need to understand our behavior in order to change it. It is helpful to be clear about what we were talking about specifically when we are trying to change unhealthy or unhelpful behaviors. And sometimes we talk about events, like we talk about having a meltdown or throwing a fit or breaking down, but those can involve very different behaviors for different people. We might name an event such as an outburst, a tantrum, a fit, but we aren't clear about what behaviors that involves. When we recognize that we want to change, it can be important to be clear about what specifically we want to change. And clarity involves describing or defining the behaviors that make up the overall event. For example, if you are describing an outburst or a tantrum event, it will look different depending on who is engaging in the behaviors. A child's tantrum might include things like screaming, which is loud sounds and no words, yelling at other people, words like I hate you, no, don't, stupid, go away. It might include hitting themselves or hitting other people, hitting objects, walls, and floors. It might include things like kicking others or kicking objects or the walls or the floor, throwing items down on the floor, flopping on the ground, pinching others, breaking items, scratching people. There's a whole list of things that it could include, and you want to list out each behavior that you mean when you're talking about the overall event. Now, an adult's angry outburst could include things like screaming, again, loud sounds with no words, yelling at other people, threats, curses, or cuss words, hitting other people, hitting objects, walls, or floors, kicking other people, kicking objects, walls, or floors, sometimes kicking holes or hitting holes in walls, floors, doors. It might be throwing items, breaking items, slamming doors. What you want to do is list all of the behaviors that occur in that event or that generally occur that might be present in that type of an event, whether you call it a tantrum or an outburst. You're just listing all of the things in the event, and that helps you know specifically what behaviors you need to work on to change and which ones should be priority. When one person describes a meltdown, they might mean crying and sobbing out loud, leaving activities abruptly, running away from other people, hiding from other people, yelling or shouting at other people, or any number of behaviors. On the other hand, a person might describe a breakdown similarly, but it might have slightly different behaviors, such as crying and sobbing out loud, hiding from other people, avoiding or refusing to shower, wearing dirty or soiled clothing multiple days in a row, refusing to eat. So these events are actually different, but sometimes we use similar terminology, and it really helps us to understand what we're talking about when we break down the individual behaviors and actions that are occurring and we list them out. That helps us know the problem behaviors and what we're looking to change. Putting this into practice is relatively simple, although it's not always easy. To describe the event, when you are calm and not in the middle of an event, think back to the event and everything that occurred. Name each individual behavior that occurred during the event. Describe who or what the behaviors were directed at. Were they directed at you, at a wall, at a door, at somebody else? Be as specific as possible. It may help to ask somebody who was present if your emotions were high, so that they can help you remember and be as specific with each action and each behavior that occurred as possible. For behavior change, awareness can be the first step, but awareness is not the solution. Knowing what specifically occurs during an event can help you develop a strategy, but often you will need the help of a professional, a behavior change professional, to help you change those problem behaviors and to find appropriate replacement behaviors. So, being aware of each behavior is not the intervention in and of itself. It is a first step, and a very helpful first step towards finding better ways to behave, especially in difficult or stressful situations. And I encourage you to practice this and then to find support to help change any behaviors that are interfering with your quality of life.